Greetings from Nairobi, Kenya, and welcome to the launch of the second phase of the Young Health Program in Kenya, running from 2021 to 2025. The Young Health Program is a program that empowers young people between the ages of 10 to 24 years to take control of their health, especially to combat long-term conditions often called non-communicable diseases, such as cancer, diabetes, heart diseases, amongst others. My name is Ogweno Stephen, a Young Health Program peer educator and an NCD champion, and I'll be your co-host alongside.
My name is Dr. Sylvia Vito. I serve in AstraZeneca as the Africa Acceleration. It is an absolute pleasure to host you all today as we inaugurate the second phase in Kenya. AstraZeneca is the main sponsor for Young Health Program, and we have a strong commitment to ensure that we not only support but fund on-the-ground activations, research and advocacy that targets risk factors such as tobacco use, harmful use of alcohol, physical inactivity, unhealthy diet, and exposure to air pollution, that all of which can lead to NCDs in adulthood. We are doing this through our esteemed implementing partners, Plan International Kenya, a formidable international organization that has been supporting vulnerable and marginalized communities in Kenya since 1982. Through the Young Health Program, we really believe that our youth will make better informed choices, health choices for a better life chance.
Remember to follow this conversation live on all our social media platforms at Plan International, at AstraZeneca. Leave your comments, questions in the comment section below. And don't forget, our official hashtags for the day is YHP Kenya and YHP Program with a double M. To start us off, we are going to invite Kate Volley, the country director for Plan International Kenya, to give us opening remarks and to get this conversation going. Welcome, Kate, and over to you. As Kate comes into this conversation, we want to remind you all that this is going live and you need to comment, leave your questions, share this feed across all of your social media platforms so that people are able to join this conversation. And again, the Young Health Program, as we said in the beginning, is a program that really focuses on non-communicable diseases and really ensures that young people have control of their health, but more importantly, that they are able to control their long-term conditions. And to start us off again, we'd like to invite the country director for Plan International Kenya, Kate Volley, to set the pace for this conversation and to give us opening remarks. Over to you, Kate.
Thank you very much, and good morning, everybody. Allow me to just recognize those who are with us. Honorable Dr. Mercy Mwangagi, the Chief Administrative Secretary, Ministry of Health, Dr. Kennedy Njau, Government Affairs Director, Sub-Saharan Africa, AstraZeneca, and our partner on this program. Dr. Sylvia Vito, nice to be connected with you again, Africa Acceleration Director, AstraZeneca. Our national government officers who are here with us today, Mr. Jacob Mwaura, Deputy County Commissioner from Mathare Sub-County, Gideon Ombugi, DCC Kibera Sub-County, and Mr. Joseph Maina, DCC Kasarani Sub-County. We also recognize the presence of our officers from the Nairobi Metropolitan Services, and ladies and gentlemen, all protocol observed. Greetings, and thank you really for joining us as we launch the second phase of the Young Health Program Kenya. As most of you will know, Plan International is an independent development humanitarian organization. We've been working in Kenya since 1982, and we strive for a just world, working with children, young people, and our supporters and partners. We work to advance children's rights and equality for girls. We've been operating, as I mentioned, since 1982, doing long-term development work across 20 counties. And we do this in close partnership and collaboration with local communities, our county and national governments, and other stakeholders. We have delivered long-term development and relief programs that focus on the well-being of children, adolescent girls, and youth, while implementing community-based interventions with a mix of individual child sponsorship and grant funding. As an organization, we continue to build powerful partnerships for children, and particularly to advance equality for girls, both locally and regionally and globally. As an organization that advances children's rights, we are very excited to partner with AstraZeneca on the AstraZeneca Young Health Program and to partner with the Ministry of Health as well. This program, as we'll hear during the course of this morning, it targets people aged 10 to 24 years with information and skills on prevention of the most common non-communicable diseases, what we call NCDs in Nairobi. Ladies and gentlemen, I think it's always important to go back to the statistics. They tell a story. NCDs account for more than 50% of hospital admissions in Kenya and have a great impact in the labor force, as NCDs are known to reduce productivity, reduce economic growth while overstretching our health system. Young people aged 10 to 24 make up 33% of Kenya's population. With the increase in NCD cases every year, the probability of dying prematurely from NCDs is 13%. This is quite high. It is therefore critical that we work towards NCD prevention, particularly among young people in Kenya. Our partnership with AstraZeneca and with the Ministry of Health through the Young Health Program provides us with an opportunity to engage peer educators in NCDs prevention. Peer education remains a key pillar in the project, and as we are better able to inspire and to encourage peers to adopt healthy behaviors because they share common challenges, strengths, and experiences. We've been working with AstraZeneca for the past 5 years, and we're very excited to partner with them again for another 5 years, building on the successful implementation we had in Kenya, and we will be expanding to 18 new areas, the remaining villages in Kibera and into a new area of Mathare. Having successfully worked with the Nairobi County and the national government to support policies and guidelines on NCD prevention, we have reached over 82,000 young people. We have also reached 267,000 members of the wider community over the past 5 years. We're looking forward to continuing this vital work focusing on NCD prevention. Our recent external evaluation illustrated incredible results, including, for instance, that the number of young people using tobacco declined more than 40%, from 47.2% to 5.9% at the final evaluation. Excuse me. Excuse me. So combining our program to empower young people to make healthier life choices with the present significant political will to address the challenge, we hope to continue to have a huge impact on long-term health outcomes. I should also mention, excuse me. I should also mention that our Young Health Program is also in line with our new country strategy, which seeks to increase the agency of young people, providing platforms for them to be part of the solution and to advocate for the things that matter to them. Ladies and gentlemen, on behalf of Plan International Kenya, I would like to thank AstraZeneca for this partnership that we've had over the years and the partnership that we'll be building on in the next 5 years. We look forward to working together in the next 5 years and to really bring in transformational change to young people. I would also like to thank the representatives of the Ministry of Health, who are a key and incredible partner that have worked with us and who will be working us to support the implementation of the Young Health Program. We're also happy that you've all created time to be with us today to join us in the launch. We are committed to working with you and to improve the health and well-being of young people in Kenya. Asanteni sana.
All right. Thank you very, very much, Dr. Kate, for that detailed opening remarks that really sets the pace for the kind of conversations we are going to have today. And remember to follow this conversation live on all our social media platforms at Plan International Kenya, at AstraZeneca. Leave us your comments and questions in the comment section below. And also, don't forget, the official hashtags for today are YHP Kenya and YHP Program. And now, I want us to have a look at a summary of phase 1 of the Young Health Program through a short video that really highlights what we've been able to do with the program. Thank you.
Vijana wana job, vijana wameingilia drugs, vijana wanakunywa pombe, vijana wanafanya violence zingine zile ambapo usipo
Non-communicable diseases mostly is a common occurrence, especially in our country. So the risk factors, lifestyle, lack of exercises, most of the people again indulging in alcohol use and tobacco use.
Our promises were basically to be able to deliver a program that addresses issues of young people in regards to health, but particularly more on non-communicable diseases and the risky behaviors.
Now that we are working with young people of ages 10 to 24, if we get people of the same ages, identify young people from the community, capacity build them with information on NCDs, then we are sure that they're going to distribute this information to their fellow peers and the information will be widespread well enough.
And very easy to create a rapport, a good relationship with their fellow youth. They tend to open up so quickly rather than an elderly person.
YHP has helped me to know how to live a healthy lifestyle in order to prevent the risks of getting cancer and other non-communicable diseases.
Number one, they gave us resources to conduct trainings and awareness, mobilization of the youth, and compared to previously, we would say there's a remarkable number of youth seeking health services.
Young Health Program has directly reached around 83,000 young people in our community here. We have developed the first ever Nairobi City County NCD costed implementation plan. We have reviewed the new school health policy. So we have achieved so much within a given short period of time, which is 5 years.
With the structures to create on the ground, we'll be able to use these structures, use the peer educators, some of the people that we've mentored, they'll be able to be supporting the mentoring of the new people who will be implementing the new program. We are really grateful for the funding from AstraZeneca to the country office to have enabled us to achieve these results.
Thank you very much, AstraZeneca Young Health Program team, Amwoods Plan International team, for that very insightful video that showcases not only what YHP is about, but gives amazing insights into how we do what we do in the Young Health Program. Good people, remember to share with us your comments, send us your questions in the chat box, and I will read these out to you in the live session Q&A that we have later on in the program. So don't touch that dial. Stay tuned and do engage with us as well on our official Twitter handles at Plan International Kenya, at AstraZeneca. The success of the Young Health Program in Kenya requires our partnership with not only Plan International, but with various stakeholders in national government, in our respective embassies, county governments, and other relevant professional societies and advocacy groups. Ladies and gentlemen, there is no one better to bring home the power of partnership discussion other than my very esteemed colleague from AstraZeneca, Dr. Kennedy Njau, who serves as the Government Affairs Director in Sub-Saharan Africa. Kennedy Njau, karibu sana daktari.
And welcome everyone. It's a huge pleasure for me to be able to join everyone as we launch the extended program YHP here in Kenya. So at AstraZeneca Kenya, we are very, very excited as staff at AstraZeneca Kenya to be part of the global AstraZeneca Young Health Program. And just a little bit about AstraZeneca Kenya. Here, AstraZeneca Kenya is part of the African cluster, and we've been in Africa for about 27 years. And our focus is to transform the lives of patients across Africa and to ensure that they have access to our innovative medicines. And we partner with governments and policymakers across Africa, and particularly in Kenya, to invest in continuous medical education through diverse platforms to ensure that our clinicians, have access to information that would help them make appropriate treatment decisions to better deliver patient care across Africa. So how do we ensure that in Africa patients access our medicines? One, very importantly, as Sylvia said, we partner with different stakeholders in government, in the community, to ensure that our community not only receives access to our medicines, but also access to comprehensive healthcare. And we do that through partnerships and through some of our initiatives, some that I'll mention just now. For example, the Africa Pumua Initiative, which is an initiative aimed at redefining asthma care through partnership with government, healthcare professionals and experts, as well as healthcare societies and governments, and the government and the Council of Governors, as well as faith-based organizations in the country. And our aim is to improve pediatric as well as adult asthma management across the country. Other partnerships that we have to improve access to health in Kenya are such as our partnership with MyDawa. MyDawa is a leading e-pharmacy in Kenya, which helps to ensure that patients receive conveniently access to our medicines through their platform. Very importantly also, we have an initiative called Healthy Heart Africa, which has been active in Kenya since 2015. And this Healthy Heart Africa program aims at raising awareness on hypertension, which is another non-communicable disease, and has reached many patients across Africa and linked many patients to treatment in order to ensure that they receive treatment for hypertension, which of course is a non-communicable disease affecting, unfortunately, a lot of our Kenyan population. Also, very importantly, is a Young Health Program, a great partnership that we have with Plan International that we are implementing and which is the focus of our discussion today. So AstraZeneca's Young Health Program is an innovative global disease prevention program that is targeted at adolescents between 10 and 24 years of age, and it forms part of AstraZeneca's sustainability ambition, and very importantly, underpinned by our focus to influence or to have a positive impact on the communities around us. It's a global commitment. It's part of 30 countries around the world in 5 continents, that has reached 5 million people so far, 5 million young people so far, and more than 20,000 health workers have been trained through this initiative. More than 120,000 peer educators have been reached through this initiative, with 50,000 volunteers hours put into this initiative. And part of it is scholarships, grants, and mentorship to young people to support them and to educate them, to make them advocates of health, of their own health. And importantly, we focus on type 2 diabetes, respiratory disease, cancer, heart disease, as well as mental health. How do we achieve this? By advocacy, creating advocates locally, nationally, and globally through education, through research, and through collective leadership, ensuring that we create advocates that also become leaders within their own communities. Today, we are announcing the renewal of this commitment between 2021 and 2025, so the next 5 years, and this is to drive policy and to continue to expand within Kibera and also into Mathare, and that really is underpinned by our belief that the youth and primary prevention must continue to be a critical component in the fight against NCDs and the work to build stronger and more resilient health systems. How does the AstraZeneca employee get involved in this? At AstraZeneca Kenya, we have health professionals that work here at AstraZeneca Kenya, and they provide mentorship and education to peer educators that are involved in this program within Mathare and within Kibera, and these young people now cascade that information back to their communities. Another way that our AstraZeneca employees get involved is collaborate with these young people to really cascade that information to their peers within the community using mainstream media as well as using social media. And another very important way is that we interact with them socially and are involved in sports activities and other community activities with them. So we are very excited as AstraZeneca employees in Kenya. We've worked with YHP, Young Health Program, for the last 5 years, really looking forward to the next 5 years to see how we can work with them, with the young people, to really continue to empower them and help them with, empower them in order for them to continue to impact their communities in a sustainable manner and to strengthen our health systems as we work together to prevent non-communicable diseases in young people as well as in the older population. So really looking forward to this collaboration for the next 5 years and welcoming you all to be part of this journey with us. Thank you very much.
All right, thank you very much, Dr. Kennedy, for those impressive remarks on AstraZeneca's commitment to the Young Health Program. And now, remember to always, this conversation is continuing online, so follow us at our social media platforms at Plan International Kenya, at AstraZeneca. Leave us comments and questions in the comment section below, and also don't forget our hashtag for the day is hashtag YHP Program and hashtag YHP Kenya. And now, allow me to welcome the Chief Administrative Secretary for the Ministry of Health, Dr. Mwangagi, to give us a brief overview of the NCD landscape in the country. Over to you, Dr. Yeah, Dr. you are on mute. If you could unmute, that would be helpful. All right, thank you.
I would think that 1 year in, we would know how to unmute ourselves. Thank you so much for that. I want to extend my appreciation to MediaMax for giving us this platform to reach out to young people and to have this extended launch of the YHD program. And then to also extend my appreciation to AstraZeneca and Plan International for collaborating on such a worthy agenda when it comes to sharing information with the youth in terms of NCDs, how they can protect themselves and how they can prevent, NCDs in their lifestyles. Let me begin by appreciating the Deputy Head of Mission. I'm not sure if he's with us, but I'm aware that we also have collaboration from the Swedish Embassy in Nairobi. To also appreciate the presence of Kate Minor-Volley, the County Director of Plan International, Dr. Kennedy Njau, one of the thought leaders and thought partners who we work with in the Ministry of Health, the Head of Government Affairs, Director Sub-Saharan Africa, AstraZeneca, Dr. Sylvia Vito, who we can see online and who's looking very good, enjoying your moderation, Dr. And then, of course, to all participants who are here today, team members from AstraZeneca, team members from the Young Health Program, team members from the Ministry of Health, team members from Plan International, and all our viewers, thank you so much for joining us today. I'll go into my keynote remarks and to begin with by saying that it gives me great pleasure to join you today for the virtual launch of the second phase of the Young Health Program Kenya. It's important to know that this program has made significant progress in fact, we are very happy because the program has managed to reach in its first phase close to 82,000 young people aged between 10 to 24 years of age, and close to 40 peer educators have undergone different levels of capacity building. Ladies and gentlemen, non-communicable diseases currently account for 39% of deaths in Kenya and up to 33% in 2014. And it is projected that by the time we get to 2030, that 55% of deaths in this country will be attributed to NCDs. And every time we speak about NCDs, what we're talking about is diabetes. We're talking about hypertension. We're talking about various forms of heart disease. We're talking about asthma and various other lung conditions, that come into play. And sometimes even this can be extended to road traffic accidents and injuries and elements of GBV. It's a whole cluster of conditions which we're talking about when we keep using the word NCDs. And so indeed, this program is so very useful because if by 2030, 55% of deaths in Kenya will be attributed to NCDs, then it becomes very important that all stakeholders, all of us who are in the field, who are in the sector, partner, and come up with programs particularly geared to our young people to be able to ensure that we can avert some of these deaths. Now, majority of the risk factors of NCDs begin in childhood, adolescence, and youth. For instance, most people get hooked on smoking, alcoholism in their adolescence and in their youth. And this also includes the consumption of unhealthy diets, including confectionery, sugar, sweetened beverages, refined carbohydrates, and other forms of junk food are more pronounced amongst the younger people. And of course, this is also coupled with insufficient physical activity at this age group. And all these are very, very important risk factors that actually impact on exposure to NCDs. A lot of studies have been done the world over. A lot of research has gone into NCDs, perhaps over the last 30, 40 years. And I can tell you, and now I'm speaking to my fellow young people, though I may not be in that cohort of 10 to 24, but these risk factors do matter, and it becomes very important for us to ensure that we lead those healthy lifestyles and avoid some of these factors that can really push us into getting NCDs. So the Ministry of Health, what we've done as government is that we've developed targeted policies that are aimed at addressing the growing burden of NCDs amongst young people. And the key response areas include looking at controlling of risk factors, particularly through collaborations with partners like AstraZeneca and Plan International. We've held various intervention sessions where we're looking at and discussing on elements such as shisha. I'm sure you're all aware in the Ministry of Health, we have banned shisha in the country, whose consumption was largely held in the adolescent and young age group. And of course, looking at the Tobacco Control Act 2007 and the Alcoholic Drinks Control Act, we've been able to put in place measures that aim to protect young people by restricting the sale of these products to minors. We've also put in place policies and strategies that serve as a blueprint for the national NCD prevention and control in Kenya. So for example, one of the key things that is very pertinent when it comes to NCD control is to ensure that some of these interventions come into play when our children and our youth are in school. And so we have a vibrant school health policy, and I'm happy because our first presenter actually mentioned the school health policy. And we have guidelines and curriculums that aim to ensure that there's advocacy messages when it comes to NCDs amongst the adolescent group. The ministry has also put in place various programs when it comes to NCDs, particularly those that affect the young people, with a focus on diabetes, type 1 diabetes, heart disease, childhood cancers, sickle cell disease, hemophilia, and asthma. And all these form part of the group of NCDs. And so, for example, when it comes to diabetes type 1, we do have a program. It's called Changing Diabetes in Children Project. And what we've done in this program is that we've partnered with the private sector to be able to reach 3,000 children and young adults who live with diabetes. And the beneficiaries of this program are able to access information when it comes to diabetes, information on nutrition. They're also able to access syringes, glucometers, and strips at no cost. And all these are very necessary when it comes to the management of diabetes type 1. And further to this, we've also supported the parents of these children. And I'm happy to see a review of the YHD program, the extended launch. I've seen there's a component that will involve reaching out to parents. That's very, very crucial and important when you're trying to run such a program for advocacy. The ministry is also targeting the rollout of the HPV vaccine that targets girls, 10 years old girls, to be able to prevent cervical cancer. Let me just emphasize here on a personal note that this is very, very crucial and important. One of the interventions that are needed and necessary when it comes to the prevention of cervical cancer. The HPV vaccine is available at all vaccinating facilities across the country. And we continue to encourage parents, particularly those who have 10-year-old girls, to really bring them to the facilities so they can access the vaccine, because indeed this vaccine saves lives. The Ministry of Health is also partnering when it comes to sickle cell disease program in 17 endemic counties, and we are working in those counties to provide information as well as care pathway management pathways for hemophilia. Through the NHIF Eduardia program, we do have the coverage of NCDs in this young age group. And these are just some of the little programmatic areas where we focused when it comes to NCDs within the Ministry of Health. I would like to thank all partners really for this wonderful initiative, to take this opportunity to thank AstraZeneca and Plan International for launching this second phase of the YHD program in 5 new villages in Kibera and in 13 villages in Mathare, in the Mathare informal settlements. I think the fact that we aim to reach 88,000 young people directly is powerful, because we know young people do have clusters of their friends, and we hope that this will then compound to another set of young people. The ministry extends its continued collaboration for this program. We look forward to actually getting down in the ground with the people and participating in all the different advocacy initiatives that you have. And we thank you so much for your support. Over to you.
Dr. Mercy Mwangagi, thank you very much, our Honorable Cabinet Administrative Secretary for Health, and a real youth in person, for your outstanding commitment to service. We are truly grateful to you, Dr. Mwangagi, for your focus on health, not only as a crucial, but as a catalytic driver to social and economic development of our country, Kenya, as you very well iterated. Asante sana. Our esteemed audience, remember to send us your comments and questions in our chat box. Engage with us on our Twitter handle, hashtag on our social media platforms, Young Health Program Kenya, Plan International Kenya on Twitter, and AstraZeneca as well on Twitter. AstraZeneca has received very high commitment from our global CEO, Mr. Pascal Soriot, our global Chief Financial Officer, Mr. Mark Dunoye, who is the sponsor for this globally funded community investment program that focuses on young health people and non-communicable disease prevention. YHP in Kenya, Phase 1, has been alive and well and rocking Kibera since 2016 until 2020 with outstanding impact and milestones that have been achieved in 8 of the many villages in Kibera. Now, to share with us the amazing highlights, achievements, and final evaluation of what the Kibera Young Health Program rollout has been is none other than our very own Mr. Robertson Obunga, a brilliant, exceptional Head of Monitoring and Coordination for Kenya. Karibu sana on stage and give us how's it been on the ground, Robinson. Over to you.
Thank you so much. I will be taking you through this. Young Health Program has been implemented by Plan International Kenya and Nandamaga Universal Relief Team. That phase targeted 8 villages in Kibera, and also, as you can see in the blue map, those are the villages that were targeted. Young Health Program in that phase was focusing on NCD prevention by targeting NCD risk factors. The program was implemented in collaboration with the relevant government and civil societies stakeholders at national, county, and civil and sub-county. That is through the Ministry of Health, Ministry of Education, and the Coalition of Youth Advocates, also known as COYA. I'll just want to take you through the outputs of the Young Health Program in the last phase. Young Health Program was able to train over 40 peer educators. It was able to directly reach over 82,000 young people through peer education outreaches. It was able to train more than 2,200 community members, 103 teachers, 1,499 parents and caregivers, and also 54 health professionals. It indirectly reached and mobilized around 267,000 members of wider community using mass campaigns, radio, and social media. Young Health Program, through advocacy initiatives, resulted in the development of Nairobi County NCD Costed Implementation Plan, review of Kenya National School Health Policy, and also increased budget allocation for NCDs in Nairobi County. Now, we contracted an external consultant to conduct for us a final evaluation of the last phase, and these were the achievements that were realized through that independent final evaluation consultancy. Around 93.3% of young people reported increased knowledge on NCD and risk behaviors compared to 66% at baseline. the knowledge and capacity of young health program peer educators to deliver correct information increased from 25%, 25.5% at baseline to 79.9% at final evaluation. 91% of community members and duty bearers reported increased knowledge on NCD risk behaviors and health needs of young people compared to 28.4% at baseline. Around 5.9% of young people were current smokers compared to 47.2%. 16.3% of young people engaged in physical activity did not meet WHO recommendation on physical activity compared to 71.7% at baseline. Around 37.8% of young people did not meet WHO recommendation on fruit and vegetable intake compared to 93.1% at baseline. We did an assessment at our health facilities, and this is what we found out. An assessment of 12 health facilities showed an improvement in access and quality of youth-friendly health services from 15.7% at baseline to 91% at final evaluation. Around 71.9% of young people reported they were satisfied with access to quality of health services offered compared to 18.1% at baseline. Thank you so much.
All right, welcome back, and thank you so much, Robinson, for sharing some of the impact of phase 1 of the Young Health Program in Kenya. And as a peer educator myself, in the phase 1 of the Young Health Program, I completely agree with you that this indeed was achieved. Remember to follow this conversation live on all our social media platforms at Plan International Kenya, at AstraZeneca, and leave your comments and questions in the comment section below. And don't forget, our official hashtags for the day are YHP Kenya and YHP Program. And now, we want to move the conversation further to get to hear from some of the young people who are directly impacted through the Young Health Program to share some of their experiences. And with me is Sakina Abdul, a peer educator from the Young Health Program. And over to you, Sakina. How are you doing?
I'm good.
All right. So I guess my first question to you really is, as a peer educator, what was your motivation to get involved with the Young Health Program?
Okay, I was motivated to be part of the Young Health Program way back in 2016. I was told by a friend that YHP was dealing with non-communicable diseases, and it was affecting me directly in the house. Like last year, my dad died of a stroke, which was led by having diabetes for more than 20 years. My mom also has diabetes and hypertension for a while now. My small sister, who got diabetes when she was 10 years, and it was sad for me seeing her injecting herself with insulin twice a day. It was very painful, and so I was motivated by that and decided to join Young Health Program to help to tell people about non-communicable diseases and how their lifestyle choices can make them have the diseases. Yeah.
All right, amazing insights there, and really goes back to the reason why you joined the program. So myself, as a peer educator in the Young Health Program from Kibera, I went ahead and took the lessons from the Young Health Program and developed my own organization called StoryLink, which really focuses on improving literacy and access to diagnostic services for non-communicable diseases outside of Kibera and to other areas, because this knowledge needs to get everywhere. And so I guess my question to you is, now that the Young Health Program is being expanded, what is, what should people expect, and why is this a very important thing that the program gets expanded for another 5 years and also gets expanded to another area in Nairobi?
Okay, thank you. So for 5 years now, Young Health Program has been implemented in Kibera, in I think 13 villages. We have villages that have not been directly associated with. So that is what phase 2 is going to do. And going to Mathare also, it is so nice because people from Mathare also will have information about the non-communicable diseases. I remember when we were going back in 2016, when we were going to Kibera and asking people, do you know what non-communicable diseases are? Or can you give me any form or any kind of non-communicable disease? And they were telling you malaria. They didn't know, they were very green. But we were telling them that, we have things like cancer, diabetes and stuff, and they were relating with it because most people also have those diseases because of lifestyle. So I'm really happy that it's going to be implemented in Mathare, so that they can help people from Mathare also. Yeah.
And finally, a very short question here is, let us give a preview to the people of Mathare on what to expect. So what are some of the exciting activities that happen at the Young Health Program, and what can you tell people from Mathare to expect from the program?
Okay, so we were doing things like Fun Day, where we go to a community ground and invite young people, all ages from 10 to 24 and even beyond, and we will do things like cooking tips. We will show them that you need to eat healthy like this. This is how your portion is supposed to be. We will have fun days where we do fun exercises that help them in living healthy, and we will tell them that you don't have to go to the gym so that you can be physical active, but you can just a little space in your house, just remove the table and do sit-ups and stuff, and you're good to go. Yeah, so those are just a little bit of the things that you are doing, and I would like to share more with the people from Mathare.
All right, thank you very much. That has been from Sakina. And people from Mathare, I want to tell you that this is an exciting program, and you will love it when it eventually lands in Mathare. And so thank you very much, Sakina, for sharing those experiences. And this really goes ahead to show what young people have been able to be impacted through the Young Health Program. Thank you.
Thank you.
Fantastic conversation. Thank you very much, Stephen and Sakina. I have with me in studio another amazing Young Health Program voice. The one and only Paul Odongo is here with me to share what it is like. What is your experience on the ground? What has been your journey through Young Health Program? Tueleze kwa ground imekuwaje, umeifilaje UIHP?
Asante sana daktari. My name is Paul Odongo. I have been a peer educator with YHP, Young Health Program, for 5 years. That is from 2016 to 2020. YHP has been quite amazing. I can say it has been quite a journey because one thing YHP has done for us, it has given us information on NCDs, something that was a new topic way back. And we have come to realize that NCDs really need to be a conversation being talked about, especially by young people. The level of exposure YHP has given us as peer educators, and even me as an individual, is quite remarkable. I have been part of a global team that went to One Young World, and that's a global
Where was
summit.
that? Just tell them.
In Colombia.
Yes.
Yeah. Under YHP, that is. We have been able to attend launches of even policies that are NCD oriented, like the Nairobi County NCD policy, the adolescent Nairobi, Kenya adolescent sexual reproductive health policy. We are able to attend these launches, and we are able to really engage stakeholders on policy level to be able to also advocate at the community level effectively.
Oh, fantastic.
Yeah.
That sounds like amazing work that you've achieved for all those milestones to be made. What have been some of what you would call highlights, high moments, which other than what you've mentioned, but also some of the challenges and learnings, because as you roll over into phase 2 with expanded Kibera and Mathare, what are some of the learnings that you're carrying forward, which could be called challenges, but me, I look at my cup half full by even lessons?
Yeah. With information, to be able to change people from perspectives and lifestyles that they're used to, especially in informal settlements where misinformation and maybe myths are predominant, it's quite difficult. And that's why YHP has been quite innovative to be able to incorporate everyone. So one of the greatest strengths that we are able to have to be able to overcome some of the challenges of myths and misinformation was the level of partnership which was incorporated under the program. We were able to partner with different stakeholders within the community to be able to send these messages effectively. Also, YHP has been quite innovative enough to be able to reach young people with things they love. For example, we were able to hold tournaments, and young people were able to turn up. We were able to have fun days. We were able to have community dialogues and even school galas where we were able to interact effectively with young people. And even I remember after COVID hit, we were able to have an online innovation where we had online platforms to be able to reach young people. So these have been quite the milestones and the innovative ways we have been able to use to overcome some of the challenges under the program.
Let's stick to that COVID conversation, because I know you are very face-to-face oriented in how you do the skating, football, drama clubs, theatrics in the communities.
Yes.
How has that been like, and what is the 1 or 2 big things that you're carrying forward into Mathare, assuming COVID is going to be here with us for a while? So even if, as we go back into probably opening up a bit more, what are your new adaptations to both either digital spaces or the face-to-face? How is that going to look like?
Yeah, I believe that in phase 2, Mathare will have quite a wonderful program, because one thing, the lessons that have been able to be learned in Kibera, even during the COVID-19 times, are able to be carried forward. So I believe that we'll be able to explore digital spaces more. We'll be able to use platforms like Facebook, WhatsApp pages, and this really gets young people engaged because you're able to share content with as much ease and speed as possible. So this really gets young people engaged. Already you'll have a good rapport with them on the online platforms. Sisi tuna relate na vitu digital.
Na kuelewa.
Yeah.
But so that we don't leave our parents and our guardians behind, because you know, we the older people, we are who we are.
Yeah.
What are you doing specifically to carry our guardians, our fathers and fathers in Kibera, now in Mathare, along this journey, which is about behavioral change? How are we targeting those specifically?
Mainly, YHP has been able to use the community leadership to be able to tap into I'll say the older generation, maybe our parents, because you'll find they're mostly involved in things like community barazas and maybe the church events. Yeah. So YHP has been able to tap into that using the different partnerships that we have been able to have with the communities. Yeah. So with these structures already existing in the communities, and Mathare included, I think it will be a great plus for YHP Phase 2 to be able to tap in that.
Fantastic. Any parting shot as we go into Mathare? What would you like to say as an encouragement to future peer educators? Kwa sababu tutaplug tukiwa wengi.
Yeah. For me, I'll use exactly what worked well for me. Yeah. So I'd like to tell young people and everyone for that matter, that non-communicable diseases is really an issue for us all. So one great thing you'll be able to do, learn as much information as possible, be able to assimilate this information into your lifestyle so you are able to practice maybe the healthier lifestyles by making informed choices.
Fantastic.
Yeah.
Ningekugotea lakini wacha tufanye hiyo high elbow yenye tumeambiwa mambo ya COVID. Thank you very much. Great having you in studio.
Thank you, Daktari.
Haya. So now going on swiftly, clearly the Young Health Program Phase 1 has been an absolute success and has had impressive impact. Now to share with us how this has been, allow me to introduce to you the one and only Charles Murio, who is the program manager for Young Health Program in Kenya, to talk to us briefly about what Phase 2 of the Young Health Program will be like. Tupatie insight, ama your snapshot. Mr. Charles Murio, over to you.
Thank you, Dr. Sylvia, and thank you, viewers, for still being with us. We've heard a lot about the first phase, and now we just want to look briefly at Phase 2, which we're just going to scale up the lessons that we've had from Phase 1. So why the YHP program really is looking at the 5 main risk factors: tobacco use, harmful use of alcohol, unhealthy diet, physical inactivity, air pollution, that will contribute to the 5 most common NCDs. So that's why we are using the WHO's 5x5 model. In doing this, and as we reach out to young people, and especially on their influencing the change of behavior, we are saying that we're doing this in a holistic way. We are not just looking at the NCD risk factors. We're also doing this, bringing together issues of health, especially sexual reproductive health for young people. We're also looking at it from a gender lens. We're saying, how does it affect young men? How does it affect young women? And in which ways? And we're also looking at the issue, the crossover of emotional well-being and how this relates with the NCD factors. So, like I've mentioned, it's a 5x5 model that is looking at the risk factors that will contribute to these key 5 diseases. So our program has 3 pillars at a global level. We're looking at programs, and this is what Young Health Program is doing, that we design programs that will inform young people about the risk factors and then inform them how to make health choices. So these programs are informed by research. And we are working with our partners to invest in research and evidence so that we are able to implement programs that are well informed. At a global level, we are also working very closely with UNICEF, who are also doing advocacy at that level, so that partners and the whole issue about NCD and young people is brought to the key duty bearers. Our strategy has 4 pillars. We are looking at all that we have said, that we want to impact young people aged 10 to 24, that they will be able to practice fewer risk behaviors. And this is as a result of increased knowledge and capacity, and also improved services. And all this happens within an enabling environment. So our program has 4 key related strategies. We're seeking to empower young people through the peer education model. And through this, we want to build their knowledge and also skills on NCD risk factors so that they are able to make informed decisions about their health. Then we're also looking at mobilizing communities to get their buy-in. And by communities, we mean families and community leaders and schools, so that they're able to get that buy-in and support that process of change. We're also saying that we are working with duty bearers, especially health service providers, so that they are able to provide quality, youth-friendly services, both NCD-related and also sexual reproductive health related. We're also looking at duty bearers and creating an enabling environment, and we'll be engaged in strengthening the policy environment, a policy environment that supports the prevention and promotion of adolescent health. So those are our 4 key pillars, learning from experience from phase 1. So briefly, we'll be looking at, we'll be assessing the NCD policy environment. We'll also be looking at collaborating with partners, and that's why we are calling all of you to come together. We work together so that we are able to ensure that the whole issue of NCD prevention among young people is prioritized. We're also looking to work with key players such as NCD Alliance, Coalition of Youth Advocates, and all other players that we can work with to make this a success. We will not stop to engage with sub-county health management team and also county health management team, so that we work together to ensure that young people in Mathare and in Kibera have an environment that they can learn and adopt appropriate health behaviors. So we will be scaling up in Kibera. We only worked in about 8 villages. We'll do 3 more villages in Kibera, and we'll also work in other villages within Mathare, the low settlement area. Ideally, we want to reach as many as 200 schools and 18 health facilities. We are seeking to reach a total of 88,128 young people directly. And we'll be doing this through engaging and training and role modeling about 54 peer educators. We'll also be reaching to train parents and caregivers, community leaders, teachers, and health professionals, so that they can join this big vehicle, this big movement as we go towards NCD prevention amongst young people. So overall, indirectly, we want to reach about 400,000 people and 196 adults within the community. This is within our implementation period. Yes, and that is it for us, and we really hope to really work with you to ensure that we realize our objective. And thank you so much.
village called Raila. I'm a peer educator working with the Young Health Program.
I come from Kibera, Kisumu Ndogo. I am a student at Kenyatta University, and I'm also a peer educator here in Kibera. My main role is just really working with the community, sensitizing them on non-communicable diseases, and I have done this since 2016, and it has really made an impact on my life and in my community as a whole.
I've learned a lot from the many activities, the many things that we have done in the Young Health Program.
Their work is to talk with people and help them overcome some of the issues they face in the slums. And therefore, just to give them encouragement and to give them knowledge and skills, we've been able to bring them here in our office in AstraZeneca. And we normally come meet with them once a month, every first or every last Friday of the month.
AstraZeneca gives us technical support in terms of training the peer educators with the technical skills that they need in creating awareness.
Our strategy is also creative enough, and we work with them through the process from the design to the delivery, implementation of the project, to the monitoring and the evaluation. So we work with young people through this process just to ensure that they are able to own up to their own health, but at the same time be able to ensure that the information they get goes through to the community and reach out to the other young people.
We reach out to these youths, tell them and sensitize them on healthy eating, avoiding risky behavior like taking of alcohol, risky sexual behavior, tobacco use. That's all we do.
The YHP program is as one of the sustainability programs within AstraZeneca that is also funded by AstraZeneca.
My experience with them has really been quite great, and I'm very happy to get involved with the young people.
We are looking forward to changing the lives of young people, especially in regard to risk behavior that can lead to contracting the non-communicable diseases.
So I'd say our relationship has been very well, has been smooth, and yeah, we have seen a nice coordination between the three, that is AMUT, Plan and AstraZeneca.
If I can change somebody's life today, tell them what they need to do to prevent NCDs. For me, I feel I could have achieved a lot.
You've had it here, you've had it fast from the people themselves, from Plan International, Program Manager Charles Muriu. Thank you very much. Together with AMUL team, together with AstraZeneca. And of course, Charles, you are fortunate to have stepped into the shoes of a great predecessor, Danoro Juang. A big heads up to you, former country program manager, and who is currently dialing in and tuning in live from London, UK. Asante Sana, and to everyone who's been involved in this. Our dear audience, this is the time that now we come to you to see what questions you've shared with us, what feedback that you've engaged with us, not only on Twitter, but on our official handles as well, on the hashtags that we had given them. So thank you very much. And it's time to see what are your comments and what are your questions. So we're going to run this together with Steve. Let's see, what are the people saying?
All right. So we have Margaret Akelo, and Margaret Akelo has comments saying, finally, congratulations and thank you at Plan Kenya and AstraZeneca for giving young Kenyans a chance. And indeed, thank you very much, Margaret Akelo. That is exactly what is going on today with the Young Health Program Phase 2.
Fantastic. I can see Edwin Musyoka, who was also on the video, saying, YHP has actually been game-changing for AstraZeneca employees, and we pray that with the second phase, it's going to see us plug in more with the communities around us. So thank you, Edson Mutisia, for that comment.
All right, as we continue again, we see Diana Adhiambo, and he's commenting that, I'm so happy for the second phase of the Young Health Program. Can't wait to continue educating the community. Clearly, she is one of the peer educators, and yeah, we are with you in this phase 2 of the Young Health Program in Kenya.
Fantastic. More comments rolling in on screen. I can see a comment coming in from Winston Samuel Origi. Plan International, as the name depicts, What it depicts is very organized, and I love working with such organized groups. Actually, so far, it's the best. The way things are rolling down is just perfect. Thank you, Mary. That comes from Winston Samuel Origi. Asante sana. We've seen your amazing comments.
All right. And as they continue rolling in, there is one from, this is Bangu Child Home. And I guess this is an organization. And they are saying, I love your report. It's self-explanatory. It's organized. A great job, Robbie from Mathare. We are ready to help you do this. And this is from Mathare, and that is where we are coming in next. And let us be, we are waiting for you as well, ready to implement this together.
Okay, Edwin from AstraZeneca also sent me a comment. He's one of our medical advisors. He says, thank you very much. We're looking forward to doing the best we can to impact our communities. Over to you, Stephen, as we close.
All right. Thank you very much, everyone, to our amazing guests and our viewers from all over the world who have joined us in this session, to the amazing crew working behind the scenes to ensure that we bring you this launch of the second phase live. Thank you very much. My name is Ogweno Stephen, and I've been your co-host. Remember, this conversation continues, and it does not end here. It continues on all our social media platforms at Plan International, at AstraZeneca, and therefore, let's keep the communication going and let's keep engaging.
Okay, thank you very much, Steve. I want to bring into the conversation, starting off number one with, I think, Dr. Kennedy Njau, who is calling in from AstraZeneca to give us his comments as we close. Over to you, Dr. Njau, before I roll over to Kate.
Yeah, so thank you very much, Sylvia, and thank you very much for everyone that has joined us today. We at AstraZeneca are really, really excited about this extension of the YHP program into additional villages in Kibera as well as Mathare. And we know that because we'll be going virtual as well, we'll be able to reach a lot more young people in the country, and how great it is to inculcate good health behaviors in young people so that they can carry them across through their lives. So really great to be part of this, great for every AstraZeneca employee to be part of this. We are really, really proud that we can impact the communities around us positively, and we look forward to really involving you and welcoming you into this journey. So thank you very much for joining, and we look forward to the next 5 years together.
I think we also have our Country Director, Plan International, Kate, to give us her thank you remarks as we close.
Thank you very much. Allow me to echo the sentiments of Dr. Njau. I think we've spent an hour, well, particularly in the initial hour, listening to the statistics and seeing the interrelationship between NCDs and hospital admissions and the connection with morbidity and mortality. We also had Sakina's testimony and as to why she became a peer educator. And I think, and sadly, this is the reality for many households, the impact of NCDs at the household level, especially for our elderly parents. I personally can relate to that story. Information is power, and what the phase 1 of YHP has showed us is that when we engage young people, actively involve them as agents of change, and give them a meaningful space to advocate on issues that matter to them, we can change the story. And we can rewrite the story for so many young people. And we can see the improvements and the data and how the numbers have changed from the baseline that we captured. And so this really does make the case that peer education and moving forward with our phase 2 YHP program has to be the way to go. We can change the story, we can transform the narrative for many households by working with young people. And so as I conclude, I just want to say thank you to AstraZeneca for the partnership globally and in country, and particularly for the AstraZeneca staff who really actively get involved in the work that we do. And of course, to my team in Plan who go out of their way to make this a reality, partnering with peer educators. Very excited to be going into Mathare and counting on the support of the Ministry of Health. Thank you, asanteni sana.
We're going to ask our guests on screen, Dr. Kennedy Njau and Kate, to make a good wave. So on the screen, so you need to give kwaheri. You know we are Africans, we have to say bye nicely. Umalizi aya. Give another high five, okay. Thank you very much, thank you all. I want to remind us that SDG Goal 17 is about partnership. And it says that for the goals that are given to us, for any industry or actor, you can't do it alone. And it will not be sufficient for do it alone to address all the converging health crises. A multitude of actions, initiatives, and investments are necessary. And more importantly, a more coordinated, mutually reinforcing ways of working is important so that we can achieve likelihood of success and setting a transformational journey towards a more resilient future. In AstraZeneca, sustainability and community investments like Young Health Program are about us as a company using our capabilities and resources to make the most meaningful impact where society needs it the most, especially in health. We know that the health of the people, the health of the planet, and our businesses are interconnected, each impacting the other. Therefore, our goal is to integrate sustainability and community investment into every aspect of our enterprise as a company, going beyond our usual commercial and R&D researches to evolve the mindset and practices of our people to meet the changing needs. We believe that sustainability and these community investments are a responsibility and also a business priority for any organization, and more importantly for us as AstraZeneca, of course, and for Plan International. So thank you all. Young Health Program, the youth kwa ground. You are the heroes, by the way. Thank you, Plan International, both local and the global organization, for the amazing work that you do. A big thank you to our partners in the Ministry of Health, the Government of Kenya, county governments, and from all of us on behalf of AstraZeneca, YHP leadership team, and Helen Sibel, who is dialing in all the way from Canada, we say thank you, all the best, and phase 2 of YHP is officially on. See you on the ground in Mathare and Kibera. Asanteni sana.